It's interesting. If you look at just wearable technologies where it is today, it's honestly kind of a fad right now. It was a trend that started maybe in 2013, but a lot of people end up tracking their own personal health and then abandoning that within 6 months. It's hard to really build behavior around it unless you're incentivized in some way. I think what's really interesting in the wearables side of things is when you start getting into ingestibles. So for example, there's a great company that has it's a little patch you wear in your stomach. You take a pill and it will tell you every time you're taking your medication, how it's impacted your sleep, your heart rate, and this is all data being transmitted out of your stomach. And that's really awesome and exciting. You think about applying that to clinical trials and getting much more data on how effective a drug is. That's really exciting. And probably the most beneficial way that wearables could be impacting health. For Oscar, we were the first company to say, hey, we will actually just send you a Misfit device. We'll pay for it, it's all yours. And every day that you hit your step goal, you're gonna get $1 back. That's up to $20 a month, $240 a year. So literally you're getting paid just for walking around every day. Because of that, we've seen a much higher adoption rate of wearable technology and people really keeping it for a longer time, because why would you give up free money at that point? But without that, I don't think that people would be using it as often. Unless you're incentivizing people, de-incentivizing people, punishing them some way, or doing some kind of gamification, either three of those methods work. If you're just looking at your data every single day, you're gonna get very numb to looking at that. You're gonna get used to every Tuesday at 3 p.m. this is what my level looks like, and you're not really gonna be paying attention to it anymore. But if there's some kind of reward or something that might happen that's negative if you don't hit certain goals, it becomes real at that point. Is it healthy to check your phone every 5 minutes because you're looking at a text message or a Facebook update or Snapchat, whatever? Not very beneficial, but I'm excited with the notion that people are addicted to looking at their phones because they're looking at their health and they're that interested in how their body is right now. So I don't think it's necessarily bad. I think if it's focused on a more rewarding aspect, then it could be a huge hit. One huge initiative we have is early diabetes detection. So we can look at claims data coming in and identify just the symptoms of a potential diabetes case. And we have a dedicated diabetes team of nurses who can get dispatched and consult the member and find out if they are actually developing a form of diabetes, because earlier detection on there goes a very long way. If you look at the other insurance companies in the US, the bar is so low I can't even show you on the camera. Every insurance company, they've been around for 60 or 70 years, and in that time, they've become one of the most hated industries in the US. There's not a single insurance company I could think of that I would be excited to go sign up and use. And if you don't see a service that fits your needs, then you should go out and build one that does exactly what you're looking for. So as a result, we are the only insurance company that's really built around the member, that rewards the members for healthy behaviors. We make it really easy to find the information you need, whether it's the proper doctor for the care you need. One really cool thing we do that no insurance company has been able to tackle yet is really transparent costs up front. So before you even leave your house, you'll know how much procedure will cost you personally out of pocket. You don't have to wait 3 months for a bill to show up and be shocked at how expensive it is. You can make the right financial decisions that ultimately lead to the proper care that you think you need. There's a wide range of people in attendance here. Everyone from doctors to CTOs to developers to designers. It's the whole spectrum. And one thing that's really fun is you sit in these workshops and you're at a table with all these people you've never met from different companies, different regions of the world. And when you're working on one problem to solve or one idea to think about, you get all these new perspectives. It's so easy to sit in one company and the same solutions keep kind of getting applied over and over again. You keep having the same dialogue. and here it's fresh every time you sit down at a different workshop. So that's been pretty exciting. Most people who are doing something innovative in healthcare in the US are very excited to talk about it. If they aren't excited to be talking about it, then chances are they're not doing something very innovative. So I'm sure an email to them would make it very simple, or any connections I can make, I'm more than happy to do so.